Hi, it's Agnes from Simple Beautiful Wellness, and today I'm going to tackle the question I get asked more than any other. What if my pain is structural? What if I actually have something wrong? Can pain reprocessing still help me? And I get why this question comes up because we've been taught that if there's something visible on a scan, such as herniated disc or arthritis, degenerative changes, then that must be causing the pain. I've been there, I totally get it. So today I want to share my personal story because I have scoliosis. I had spinal fusion surgery at 16. I have actual structural changes in my spine. And I still use pain reprocessing therapy to address how I experience my chronic pain. I've used mind-body approach to really tackle my chronic pain, chronic fatigue. So let's talk about what happens when you have real structural issues and why your nervous system might still be the key to your healing. So if you've been told your pain is structural or you've seen abnormalities on images and thought, well, this must be causing my pain, I want you to stay with me. Because what if I told you that the research now shows something completely different? That your nervous system and your stress levels have more impact on your pain experience than the actual structural findings on your scans. It's mind-blowing research. And that even if you do have structural issues, your brain might still be amplifying that pain or even creating pain independently of the structure altogether. It's really such a great news for us because this really changes everything. So let me show you how. And let me tell you a little bit of my story again. So when I was a teenager, I was diagnosed with severe scoliosis. My spine had significant curve that was getting worse. At 16, I had a spinal fusion surgery, so I had rods and screws in my spine, in majority of my spine, to straighten and stabilize it. And from a surgery perspective, the surgery was, very successful. My spine was straighter, more stable. But years later, and then decades later, I developed debilitating chronic pain. And here's what every doctor, every specialist, every well-meaning person told me. Of course you're gonna have pain. Look at your spine. You had major surgery. You have hardware in there. You have structural changes. You have scoliosis. This is your reality. And I believed them. For years, I thought this was normal. I thought that my body is damaged, my spine is compromised. Of course I'm in pain. I have scoliosis. This makes complete sense. But here's what didn't make sense to me. The pain would come and it would go. Some days I'd wake up in excruciating pain. Other days it was minimal pain. And the pain would move around. It wasn't until I was in debilitating pain in bed that my pain stayed consistent. But other than that, when in those early chronic pain stages, my pain moved. Sometimes hips, sometimes lower back. And the pain didn't at that time correlate with activity. I could do something risky one day, be fine, do the exact same thing the next day, and I was in agony. So if my pain was purely structural, if it was about just the fusion and hardware and the changes, it would have been consistent. But again, it became consistent in my debilitating pain. So I was a little bit confused and I was really looking for a way out, and I started questioning. What if the structure isn't the whole story? What if there's something more? Can I try something more? What if my nervous system, like how I'm experiencing stress, is playing a bigger role than I thought? And it wasn't just stress. I started thinking about even my emotions and how I'm experiencing things. And took me a lot of time. And I started researching and trying, like everybody with chronic pain, trying to find my way out. And what I found, eventually changed everything for me. So what research actually shows us is study after study shows that structural findings on imaging do not reliably predict pain. And that was mind-boggling to me at that time. So we've talked about this in the previous video. If you haven't seen, I'll link it, but it's really worth repeating. Large studies scanning people with no pain found bulging disc, herniated disc, arthritis, degenerative changes at the same rate as people with no pain. And that gave me so much hope, because for me, it meant if my imaging is like this, could there be, and I had scoliosis and fusion, could there be another person in a similar situation with no pain? And those studies kind of gave me this, I started thinking, structure doesn't equal pain. And, over time, as I started using pain reprocessing therapy, I found even more interesting research showing that our nervous system state, our stress level, emotional states, and fear and anxiety have a massive impact on our pain experience. And, more recently, a study published in journal Pain showed that psychological factors like stress, anxiety, fear, avoidance beliefs were stronger predictor of chronic pain than actual tissue damage. Mind-blowing. Another study on mindfulness-based stress reduction for chronic pain found that participants experienced significant pain reduction, not because their structure changed, but because their relationship with the pain changed. Their nervous system calmed down. And then we have research on pain reprocessing therapy published in JAMA Psychiatry showing that 2/3 of participants were nearly pain-free or pain-free after the treatment. Not because their discs healed or their arthritis disappeared, but because their brains learned the pain signals were for false alarms. So really what's happening is, even if you do have structural changes, even if you do have something visible on scans, your brain is still interpreting those signals. And if your brain believes those structural changes are dangerous, that was my case for such a long time, it amplifies the pain signal. Your nervous system goes into protection mode, your muscles tense, your pain pathways became super sensitive. And this is really called central sensitization. Your nervous system becomes so good at producing pain that it does it automatically, even when there's no actual tissue damage happening. So you may have structural changes and neuroplastic pain happening at the same time. The structure might be there, but it's not the primary driver of your pain. Your nervous system is. And here's the beautiful part. Even if you can't change the structure, like in my case, you can change your nervous system's response to it. And that's what I did. So here's the decision that I've made back then, being in bed with debilitating pain. And this goes back to the video I've just mentioned, power of decision making. I looked at my options. I could believe, and I could keep believing, that my pain was purely structural. This is it for me. I'll be in chronic pain for life. I was damaged. There was nothing I could do except manage symptoms, maybe get more procedures, maybe another surgery. Or I could try something different. I could explore possibility that my nervous system, my brain's interpretation of my body was playing a major role in my pain. And here's the thought that really changed and helped me through that journey. I can always have the surgery later. What if this approach, what if this mind-body approach actually works for me? What do I have to lose by trying? And that question, what do I have to lose by trying, give me permission to experiment. I didn't have to be 100% certain that pain reprocessing would work. I don't have to abandon everything I've been told about my structure. I just had to be curious enough to try. So I committed. I gave it real time, months, not weeks. And I approached it with this genuine curiosity. What if my brain is overprotective? What if it's overprotecting me because it thinks my spine is fragile when really my body is stronger than I've ever given it credit for? What if the pain flaring up when I'm stressed isn't about my structure at all, but my nervous system being activated? What if I can retrain my brain to feel safe in my body again? Even with the fusion, even with the hardware, even with the structural changes. So I stay curious instead of dropping into that catastrophic thinking. And when pain showed up, instead of immediately thinking my spine is failing, this approach is not working, I try to gently move into what was happening before this pain started. Was I stressed, anxious, worried about something? And more often than not, the answer was yes. The pain wasn't random, it was patterned. It was connected to my emotional state, my stress levels, my nervous system, not to my structure. And slowly, very, very slowly, I started to heal. Not because my spine changed, not because the fusion magically reversed, but because my brain learned we are safe. We don't need to sound alarm anymore. We can turn down the pain signal. And that's exactly what had happened. Now, I want to be really clear about something here too. I'm not saying structure never matters. I'm not saying all pain is just, in your head. Not at all. What I'm saying is that most chronic pain that lasted months or years, that comes and goes, that doesn't correlate clearly with activity, your nervous system is playing a much bigger role than you have been told. Even Dr. Sarno talked about this. He said that even people with structural abnormalities, herniated disc, spinal stenosis, scoliosis, could have TMS, could develop TMS symptoms, because the structure might be there, but it's not necessarily the source of the pain. We know that our pain is very complex. We know that brain thinks that this, structure is dangerous, especially if we receive this messaging for a very long time. So it creates that pain to protect you. But what if you can teach your brain that you are actually safe, that your body is strong, that the movement is safe, that the structure isn't a threat? And, with time, that pain can resolve, even with the structure being there. Just think about me. I still have my spinal fusion. The hardware is still there. My spine still has the same structural changes and challenges I had when I was in debilitating pain bedbound. So what changed wasn't my structure. What changed was my nervous system interpretation of my body and my state. And that's really what the research on mindfulness, pain reprocessing therapy, and stress reduction points to. When you calm down your nervous system, when you reduce fear and catastrophizing, when you teach your brain safety, pain decreases. Sometimes dramatically, sometimes completely. Not because we fixed the structure, not because we, addressed the actual driver of the pain. We've looked at the nervous system. So if you're someone who's been told, your pain is structural and you've been resigned yourself to living with the pain forever, I want to offer you this. What if you stayed curious? What if you ask, what do I have to lose by trying mind-body approach? You can always go back to, structural treatments. You can always pursue procedures or surgeries later if you need to. But what if you give, mind, body, or pain reprocessing a real chance first? What if you explore whether your nervous system, your stress, your fear, your brain's protective responses is amplifying your pain? What if you worked on calming your nervous system and retraining your brain and teaching your body that it's safe? The worst that can happen is you learn some valuable, regulation techniques. You create new pathways for joy instead of pain. And the best that can happen, just like me, you can approach the chronic pain with a different understanding, just like so many others have, even with structural issues, because structure isn't the destiny. Our brain's protective role is really the missing piece, and that's something, we have power to explore and we have a power to change. So if that's something that resonates with you, let me know in the comments below if you want to hear more about it. If you want to explore if you have neuroplastic TMS or symptoms, grab my free starter kit. It's linked in the bio, and I'm gonna link under the video below. I know that so many of us, especially with scoliosis, our chronic pain lives with us day to day for years. I know it's possible to explore the mind-body connections, because I have seen with so many of my clients, and you can, and many others, and that's something that you can explore as well.